Hello, our today topic of discussion is asthma. In this topic, we will study about the signs and symptoms, diagnosis and treatment of asthma. Okay, let's discuss about the history of asthma. Asthma has been known since antiquity, means it's a very old disease. It's not a new. And the word asthma is Greek origin, which means panting. Panting means out of breath. We commonly use panting for out of breath. And more than 2000 years ago, Hippocrates used the word asthma to describe episodic shortness of breath. Hippocrates is a scientist who used the word asthma for episodic shortness of breath. And let's discuss about the proper definition of asthma. According to National Asthma Education and Prevention Program, asthma can be defined as chronic inflammatory disorder of the airways in which many cells and cellular elements play a role. Asthma is a chronic inflammatory disorder of our respiratory airways. So, let's discuss about mechanism of asthma. In asthma, when asthma occur, our bronchi and bronchioles of our respiratory system become swell, and there comes mucus which cause uh, constriction of bronchioles. Because of constriction, airway passes narrow and we feel difficulty. And you can see in this picture difference between normal way and during asthmatic symptoms. And here it's another pic of normal lungs and between asthmatic lungs difference. In normal lung there is a lot of air to passage, and in asthmatic condition our bronchi and bronchioles become narrow because of secretion of mucus. Okay, let's discuss about the incidence. It is estimated that every year 25 lakh Asians suffer from asthma, and it is likely to increase 25 to 50% by 2030. And when we compare between men's and women's, it is estimated that women have a 30% greater prevalence of asthma as compared to men. Let's discuss about the asthma triggers. Asthma triggers are those which cause asthmatic condition in any patient. It's mean they trigger asthmatic disease or asthmatic shock, and these may be involved our air particles. In asthmatic triggers, it may include dust particles, smoke, pollution, stress, yeah, even pets, or even exercise extra. And we will discuss these asthma triggers in detail next. Let's classify triggering factors of asthma. First one is allergen inhalations, mean those allergen which we inhale and trigger our asthmatic disease. And first one, it may include animal, house duck, and cockroach and pollens. And others are air pollutants, means exhaust fumes, perfumes, oxidants, and cigarette smokes. And viral upper respiratory infection, sinusitis, these may cause asthmatic shock. And exercise and cold dry air, stress, and even drugs, aspirin, NSAIDs, beta adrenergic blockers, these all may cause asthmatic shocks. Okay, next are occupational exposures. Occupational mean that at particular time or particular place. These may include metal salts, wood and vegetable dyes, industrial chemicals and plastics, food additives, gastroesophageal reflux disease. These are may cause asthmatic shock. Gastroesophageal reflux disease means when our motility reverse, and it may cause gastroesophageal reflux disease. Okay, next we have type of asthma. We classify broadly asthma into three types. First one is allergic asthma, and second one is non-allergic, and third one is mixed. And we will discuss them one by one. Okay, we have first one, allergic asthma. It is also called extrinsic asthma, and when these symptoms are induced by a hyperimmune response to the inhalation of specific antigens, this type of asthma is called allergic asthma. And this is type 1 hypersensitivity reaction, and it is basis of IgE. As you know, there are four types of hypersensitivity reactions: type 1, type 2, type 3, and type 4. And type 1 is called immediate hypersensitivity reaction, and the allergic asthma is one of them, type 1. Next we have non-allergic asthma. It is also called intrinsic asthma. First one was called extrinsic, and this is intrinsic. You have to keep difference between them. Okay, this type of asthma is triggered by the presence of irritants in the air that are not related to allergens. It's so we can say that it's non-allergic asthma, and the first one was allergic. These irritants stimulate parasympathetic nerve fibers in the airways, causing bronchoconstrictions and inflammation. Okay, the third one is mixed asthma. Mixed asthma is a combination of both allergic and non-allergic asthma, and this is the most common form of asthma. Okay, there are other types of asthma which may include cough variant asthma. This does not have the classic symptoms of asthma such as wheezing and shortness of breath. Instead, it is characterized by one symptom, only one symptom, that is persistent dry cough. Only a patient who has a persistent dry cough, that may be called cough variant asthma. And next one, exercise induced asthma affects the person during or after physical activity. Means when a person do exercise, and by that the asthma induced, it may be called as exercise induced asthma. And next one, nocturnal asthma, it is characterized by the symptoms that gets worsen at night. Those who suffer from nocturnal asthma may can also experience symptoms any time of the day. And occupational asthma, it is induced by triggers that exist in person workplace, including textile, farming, and woodworking. Okay, let's discuss about the clinical manifestations. Means what are the clinical signs of asthma? First one is wheezing. Wheezing are the sounds that is created by that is created during breathing. And dyspnea. Dyspnea means shortness of breath, cough, chest tightness. Expiration may be prolonged. Means when a patient expires, it may take time, and secretions may be white, thick, gelatinous mucus. Okay, when a patient come and we have to diagnose, we will study diagnostic we do diagnostic studies, and this may based upon history, and we will discuss about patient about his history. And then physical examination, we will study about these physical symptoms of asthma in the patient. Pulmonary function test, peak expiratory flow rate, we will discuss about the rate of expired air. And the next one is chest x-ray, allergic skin testing, blood level of eosinophils and IgE. These are indicators of asthma. Okay, management of asthma, according to asthma name, A means adrenergic beta 2 agonist. It's an example of albuterol. And steroids, thiophylline, hydration, mask, anticholinergics. These are involved in the management of asthma. Okay, next one is drug therapy. When a patient come, how we can control asthma? We will give patient to following drugs. These may include anti-inflammatory drugs, corticosteroids, bronchodilators, long-acting beta-2 adrenergic agonists, and theophylline. Okay, for quick relief, we may give following drugs. This may include bronchodilators, short-acting inhaled beta-2 adrenergic agonist, anticholinergic, and corticosteroid. Next, we have risk factor of asthma in young children. As we know that asthma is more common in children as compared to adults, and there are ratio that it indicated that asthma mostly occur in childhood. And the risk factors to asthma in young children includes sensitization to allergens, maternal diet during pregnancy or lactation, pollutants, particularly air in environmental tobacco smoke. Next one, microbes and their products, respiratory infection that may be viral or bacteria, and psychosocial factors. These all are factors which may cause asthma in young children. Here are challenges in childhood asthma, which cause asthma more prominent in childhood. This may include most of the children are below 5 years of age and who cannot tell their problems. And second one, parents are proxy storyteller who may mislead the doctor. Fear of addiction to inhalation therapy, physicians lack of knowledge and time. These are challenges that may be faced by childhood asthma. And these are clinical features again. As we have already studied, these may include recurrent wheezing, cough, breathlessness, activity induced cough or wheeze, nocturnal cough or breathlessness, tightness of chest. When does asthma begin? It is estimated that 26% asthma begin in first year in childhood, and 1 to 5 years there are chances of 51.4% of prevalence of asthma. and in more than 5 years there are chances that 22.3% 22.3% childs can be affected by asthma, and it is also estimated that 77% of asthma begins in children less than 5 years. And tools to diagnose to asthma it may include good history taking, means ask careful physical examination, which we can say look, and investigation means perform above 5 years only. Okay, during history we ask the following question to the patient. You can say these are questions to your patient to answer them. You can read it yourself. So if the answer is yes to any of the questions, a diagnosis of asthma should be considered. Okay, let's discuss about the management. Common treatment may include high doses of inhaled bronchodilators such as albuterol or levodopa to open up your airways. Oral injected or inhaled corticosteroids to reduce inflammation. Ipratropium bromides, another type of bronchodilator, different than albuterol, and epinephrine short temporary ventilation support. So in short we can say that we give patient to corticosteroids, anti-inflammations, bronchodilators, and temporary ventilation supports. These are involved in management of asthma.